You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Jeff Byars, thank you so much for being on the Patient Advocacy Now podcast. How you doing today?
I'm doing good. Thank you for having me.
Yeah, it's a pleasure. You probably wouldn't say this about yourself, but I'm going to say it for you. You were awarded Advocate of the Year at the Health Advocate Summit last year, were you not?
I was.
Congratulations. That's amazing.
Thank you.
And so we got an award-winning advocate with us. I guess the first question is, what do you think? Why do you think they were so, insistent on naming you Advocate of the Year? What makes you different as an advocate, and how do you go kind of above and beyond the call of duty there?
One of the things that I do different is I'm available beyond standard business hours. I realize that your healthcare doesn't happen on a 9-to-5 schedule, and I try not to operate on that as well. I've dealt with clients as early as 6 o'clock in the morning and as late as midnight, and I think maybe even a little later. So
yeah. And I think that's important to know, because it's when things happen, they happen totally outside of your control.
Absolutely.
What's your background so that everybody can kind of understand your journey into becoming an advocate?
So I have been an EMT for over 30 years now. I've done that as a career. I still do it as volunteer with my local fire department. I've been very active in EMS in the state of Alabama. I have a degree in accounting from the University of Alabama at Birmingham. I spent 14 years in reimbursement audits for Blue Cross Blue Shield of Alabama, auditing both hospitals for private insurance, Blue Cross, and for governmental for Medicare. I worked a few years at UAB Medicine doing reimbursement for clinical trials. So I got to anything that was implanted in the hospital that was a trial device got to come across my desk for financial analysis. Really interesting, because you looked at some stuff that was really space age type inventions that were coming out, and other stuff you just looked at and shook your head and say, why did I not invent this? So did that. Thought I had a pretty good grasp on medicine. I had worked as a provider of healthcare and done that for, like I said, for all these years. I had worked on the business side of it, doing audits for Blue Cross, worked in the hospital in the business side of it. I knew both sides of the business, and that's kind of my background. How I got started
diverse. It's a pretty weird and diverse. I mean, you're an EMT, but you have a lot of financial background as well, which is it's pretty uncommon, isn't it?
It is. It's kind of unusual to find somebody that in healthcare, when you in the hospital setting especially, it's kind of unusual to find somebody that is on the business side and the healthcare provider side. That's kind of unique.
What did you? We'll go back in a second to how you kind of got into advocacy, but before we drift away from this, first of all, I have to ask, what was one of those things you saw where you were like, why didn't I come up with this? Do you remember any of those gizmos?
Oh, there was one device that it was essentially saving in like orthopedic surgeries, saving some portion of the bone when they're shaving off and attaching different pieces to use that as a graft to reattach and to spur growth for bones. It was really a fairly simple device that they had that worked to extract that and to save what would essentially be a waste in a surgical procedure to use to help that patient out.
And it's something really simple where you're like, how did everybody miss that?
Yeah, it very simple. Yeah, it was essentially just, getting some of the excess fluid out of some of the bone marrow to reuse that bone marrow.
Wow. But that's significant, though, because bone marrow it doesn't really grow on trees. So you don't want to waste any of it. Yeah.
Exactly.
One other question I have for you, since we talked about your diversity in the background between healthcare and finances, and you also, it sounds like, when you talked about your background, you had experience on the government side and the insurance side. There is this kind of look that advocates have when it comes to healthcare and finances, and whether there's, do you have a particular viewpoint on if that's hurting or helping the medical system in America, and what do you think anything's broken or needs fixing? I'll just kind of leave it open-ended to kind of get your thoughts on it.
Healthcare finance is a unique animal in the fact that it's probably the only industry that I know that revenues are really more of a statistic than they are actual cash money, compared to other industries that they sell something, they get $100 for it, it's $100 they've got for it. Healthcare, it may, and I'm exaggerating this extremely, but if it's a $100 procedure, it's probably not putting $100 into their pocket. When it goes through the contract negotiations with insurance, it may be they're getting $25 for this, or maybe even less. If you're negotiating to do it self-pay, you may be paying less than that, but the charges still hit their balance sheet, and their income statement is showing that $100 worth of revenue on their income statement rather than the money that they actually receive. They have to put a contractual in there to reduce that down. So it gets really confusing when you look at it and somebody gets a bill and they've got this $50,000 bill and they look and they say, wow, insurance paid $2,000 on this and I don't owe anything else. And that's kind of the buying power that you give with insurance, is that discount that's in there. But oftentimes you can negotiate that discount as a self-pay person as well. If you're, have advanced knowledge that you're going to need this procedure, you may be able to negotiate that with a facility and ask for a reduced rate to pay cash and pay all at one time.
Do you find that hospitals struggle with, because it's funny, most advocates, when we talk to them, they take on, because they work with clients directly, they take on the perspective of the clients and the patients saying, this is confusing and stuff. But you kind of bring up a good point. Do hospitals kind of struggle to figure out how much they're actually going to be able to collect from insurance with negotiation? Is it a burden on the hospital as well?
There's always negotiations that go on with these. And it kind of depends on which insurance company they're dealing with, what their basis is for patients in that area that have that insurance, what the saturation of the market is. There's a lot of factors that go into that negotiation to get those rates at where they're going to be for insurance purposes.
Okay. So it's just part of the part and parcel. It's just kind of business as usual for hospitals.
It is.
Yeah. Your background as an EMT, when did you decide to become an advocate? Because you at what point?
So I really didn't know anything about advocacy. You always hear the term, you've got to advocate, and you really hear it in pediatrics. You got to advocate for your child. You've got to advocate for your child when they're in healthcare. But it didn't ever really click with me on anything until my daughter was diagnosed with, we found a tumor in her at 7 months of age.
Wow.
And she went through quite a spell with that, was misdiagnosed by several facilities. We went in for a surgical procedure to have her tumor removed. Thought it was going to be a 7 to 10 day stay in the hospital. We came out, I think it was 86 days later that we come out of the hospital. Went through lots of chemotherapy, like I said, several surgeries, more blood transfusions than I can count. And we realized just how difficult it is to navigate that system. And it was difficult for me. My wife's a biologist. So for the two of us with the background we have, you would think we would be able to navigate that system really well. And I'd never really thought of it until I got put into that scenario with my daughter and realized just how complex and difficult it can be when you've got a really serious medical condition and you've got oncology, you've got nephrology, you've got urology, you've got all these different subspecialists involved and making sure that they're communicating with each other. And it's just really difficult, and more difficult than it should be. And if it was difficult for me with my background and difficult for my wife, then somebody that had no connection with the healthcare industry whatsoever and no background in medicine was going to be lost.
Yeah.
And I realized that. So once we got Claire past the point of where we were in depth with treatment every day, I took a leave from work for a couple of years to manage her health care.
Wow.
And once we got past that, I started looking for something to do to get back into the workforce. And I thought, well, I've been in healthcare reimbursement all this time, but if I'm going to make a shift, it's a good time to make a shift. I've been out of the game for a while and started looking at, just by luck, call it a God thing, whatever you think on this, it was just sheer coincidence. It was just a blessing that I stumbled into the Patient Advocacy Certification Board. And I found that exam 3 days before the closure of signing up for the very first sitting of that board certification. and thought about it, decided to go ahead and set for the exam. I sat for the exam, passed it to the first setting of that, and then I sat on that still for a while. I wasn't exactly sure what I wanted to do, and finally just decided to go into business on my own, doing independent advocacy and give it a run and see how it panned out.
And what do you find, and obviously it's panned out for quite some time. How many years has it been?
So I opened up in 2020, just right before COVID hit. So it was a wonderful time to open a new business when right as COVID's coming up. But managed to survive that. Luckily, a lot of what I do can be done remotely. So, I'm still able to interact with clients and help them out, even though we weren't able to go into hospitals often and weren't able to be there face to face. We were still able to help folks out.
And what do you find people are in need of most in your own practice with your help?
The two biggest things that I get calls from clients on are help with billing and insurance issues. And I help them whether there's so much that has to be precise in the healthcare billing for it to go through with insurance. And if you get a code wrong, it's going to be rejected. You get a date wrong, anything that's not read by the computer correctly, it's going to get rejected. And then you've got to figure out what that problem is to get it to go through. So I do a lot of that.
Just to be clear, the code on the healthcare side is getting rejected by the insurance company or vice versa?
From the healthcare side, when they submit it, if it doesn't match, if it just doesn't make sense and it doesn't go through their algorithm, it's going to reject it. It may be a completely incorrect code. And the codes for medical procedures and charges now are so complex. Had a physician friend of mine tell me back the last code update that they had was, it used to be if you build on this, it would tell you that a patient had come into the ER because they had a bump on the head. And now they've got a bump on the head that come from a golf ball that was hit from 150 yards away by a left-handed golfer. It's so precise now of what these charge codes are telling, and sometimes they get off a number, and it may not coincide with what the diagnosis code is, so it will reject a code.
Who makes
there's so much complexity
Who makes
that can
that
happen.
book of codes?
That, I'm assuming it's a government. I don't even know exactly who controls that and pushes that out. To be honest with you, I just know it's a lot. It's more than what I get into, actual coding. I do have someone that helps with the coding process if it comes down to that.
Sure.
But there's also other things that can kick things out. I've had a recent client that it was simply the insurance company needed more supporting documentation from the hospital. And somehow that message got lost in translation. The hospital didn't send the additional documentation. The insurance didn't get the documentation, so they rejected the claim. It goes back to the hospital, is rejected. They send a bill to the patient, and then they're calling me saying, "What's this $20,000 bill that I owe? Can you help me untangle this?"
How do you even begin to process? It's this game of telephone. What is the actual work? I mean, the process you just described. There's 7 or 8 different connections that need to be made. How do you play detective and figure out where the ball was dropped?
I wish I could tell you I had a magic wand that I could wave and just get to the right person at the insurance, but it's not always that way. I know kind of how those insurance agencies work or the companies work, so that helps a little bit, but a lot of times it's just we've got to call, get through their phone bank system, and everybody's made those phone calls too, whether it's a doctor's office, a hospital, a bank, wherever you call, and it's press this number, and you just get so frustrated going through the phone bank. You've got to get past that to actually get to somebody that can understand what the problem is, that has the authority and is high enough up to make that decision and to escalate that scenario to where they can find out what the problem is. And sometimes I take several phone calls just to get to the right person. And it may be a phone call, you get to a right person, they tell you what information they need. You've got to go back to the client, get that information, or maybe to their provider and get information, and then back to the insurance. So a lot of times there's a lot of back and forth with a lot of moving pieces there.
And so if you're someone who's not used to having that be part of your daily process, I could see how that's not only confusing but frustrating, and you're trying to manage. In your case, it was your daughter's, health issue. It's the last thing you want to deal with.
Exactly. When you've got family member that is ill, they're in the hospital, maybe they're at home, but they're recovering, they're undergoing outpatient treatments, they've got multiple appointments at multiple times and all of this stuff to go through. The last thing they want to worry about is having to call somebody and press this number, set on hold, call another number, try to get a hold of somebody. That's just not what you want to have to do when your loved one's ill, or if you don't have anybody to do that for you and you're the sick person that's trying to recover and trying to do this at the same time. It's just near impossible.
Yeah. And you've been in those shoes as well. You're a cancer survivor yourself.
Yes.
And did you have to do this while you were dealing with your own treatment?
Luckily, my treatment was not as severe. I had thyroid cancer, so it was not as difficult. I did have a little hiccup with it. I had the small percentage of cancers that don't show up on the initial pathology report, so they pulled part of my thyroid out, had to go back in a week later and pull the other side out. So I won't say it went completely without hiccups. There's nothing like hearing your surgeon call and you're a week out and you know there's a problem immediately when the surgeon calls. Mm-hmm. And so there are issues to deal with, but I didn't have the billing issues to deal with that. I had good insurance at the time, and it's, everything flowed through as it should. But occasionally you run into that. You run into, I did have some issues with FMLA, and it was not on my employer side. It was on the physician side, getting them to actually complete the paperwork that had to be completed for me to be off work, to submit that. Had a physician at the time, the endocrinologist that I was paired up with, told me it was fine, that I needed to be back at work in a period that they had me off of all thyroid medication, getting preparation for a radioactive iodine treatment. So I was off thyroid meds for 2 weeks, and anybody that's on those meds will tell you that is a disaster if you're off of it. I didn't know at the time, so I kind of went along with it. I drove back and forth to work. It was the middle of summer. I was wearing long sleeves, wearing jackets. I was going out in the sun to warm up because it was so cold, and realized after the fact that I should have never even been driving in that state. But,
Wow.
The doctor had told me, oh, you need to be going to work, you're fine, and wouldn't sign any FMLA paperwork for me to be off work during that time period. So I went to work thinking that's what I needed to do, and realized looking back on it as I didn't need to be driving in that state because my reflexes were not as good as they should be. And so you do run into issues that's not just billing. You run into communication issues with providers and other members of the healthcare team that can really cause problems.
And in your particular case, do you believe that it was just a misinformed physician or the endocrinologist, or was there pressure being put on him to not fill out the paperwork for some reason?
I couldn't tell you on that. I will tell you that particular provider, once I got beyond that, I did fire them and go on to a different endocrinologist and haven't had any problems. So that's not the peak of what I do is getting rid of physicians and saying, see you later. But sometimes there's just not a good fit with people.
Yeah.
We all have different personalities. Sometimes we don't get along. It may not be the best fit. Maybe they're overworked. Maybe their caseload is too much, and you just need to get to one that can give you a little more attention and work with you a little better.
I think that's a fair point. Everybody has their own match of what is and isn't a good fit.
And we've all got our good days and our bad days. We're human. It happens. I don't know, did that doctor have a bad night's sleep the night before? Was their kid up sick and they lost sleep, so they were, not as on top of their game? There's so many variables that can go into this. And really my point is not to point blame at anyone when I get involved with a client that has a situation like this, but to figure out what we can do to solve these issues and move forward. That's improvement for everybody.
Yeah, absolutely. And it sounds like your practice expands beyond just insurance and billing. Is that right?
It does. Beyond the insurance and billing, the other major part that I work with is a lot of it just communication, making sure that whether it's the patient and their family understands what's going on. Sometimes I'll go to doctor's visits with, say your mom or dad was sick and needed to go to the doctor, and you're doing this podcast in the middle of the day. This is your job. You're not able to go with them. You can't take off short notice to go. I can be that person to go and be an extra set of eyes and ears to help mom or dad understand what's going on, make sure they ask the questions that they need to get the answers that they want, and also be able to relay that to the family if that's what the patient wants, to make sure everybody understands what's going on and everybody's on the same page.
Yeah, I think people often underestimate how important that is. When I have 4 kids myself, and oftentimes if my wife's busy and I got to take one of the kids to the doctor, And she says, make sure you say this, this, and this. By the time I get to the doctor's office, they're like, and how long ago did this start? And I'm like, let me try to call my wife. I don't.
You're lucky if you got the right date of birth with 4 kids, I imagine, on there.
Yeah.
And so I completely understand it. It's, and a lot of folks have what we refer to as white coat syndrome. They get in the doctor's office and they kind of, they freeze up, they forget, they get nervous, and oftentimes you've been through and answered these questions 10 times before you actually get to the physician that you're seeing, and you may forget some of that. It's kind of like when we were in elementary school and you played telephone and you told the person beside you a story and they tell the next person. If you do it enough, you kind of forget some of those details.
Yeah. So
And
when you
it's
go
real
in,
easy to do.
do you have a pad and kind of like a little bit of a medical history with your clients then to try to keep
I
them
do.
going?
I try when I onboard a client, I try to do a really in-depth history with them, which is I'm fortunate enough to spend time with them that most of their physicians are not in that scenario. And this may be 2.5 hours that I'm having a good conversation with them, depending on how complex their disease or diagnosis is, to find out exactly what's going on, what medications they're on, what symptoms they have, and beyond what the medical, just in life, what's bugging, what is causing them problems, what is a fly in the ointment, if you will, if it's really difficult to park at this facility, or it's hard to get a hold of somebody on the phone, or I've got this insurance issue, whatever else beyond just strictly the medication part of it, the medicine part, what else is hindering them from, getting the best out of their medical care that they can.
Yeah. And a doctor who has so many patients they have to see a day with a certain protocol in the hospital just doesn't have the time, can't afford the time to do all that.
They can't afford the time. Sometimes patients feel rushed. They know that doctor's got to get to the next patient, so they feel rushed. They don't want to stop them as they're going out the door and say, hey, wait, I forgot about this. So that happens a lot, and I try to be there for that. And like I said, I have the intake consult with them where I get in depth with them. But then before each meeting that I go to with them, each appointment, I'm having a session with them to let's go over kind of where everything's at today. Has anything changed? Is there anything else? And kind of have our bullet points ready of what we want to make sure that we discuss with the doctor. Now, that being said, I'm not making any decisions for my clients. I'm just helping them make sure they get the information relayed to the doctor that they will them to know, and that they're finding out the answers that they want to know.
Yeah, that's pretty clear. I think that's important because, like we said, that between the white coat syndrome or the fact that there's just so much that you might forget, it's important to kind of have that organized mind going into that session you have with the physician.
And sometimes these clients may be seeing 3, 4, 5 different doctors in a day. If they've had their care coordinated where it's one trip to a major medical center, they may be traveling several hours to go to this bigger facility that has all of the specialized care that they need. They may see a lot in one day, and it's overload to them.
Yeah.
And you get into that 3rd or 4th appointment of the day, they're exhausted. They're ready to be done with it, but the end, they're there. They need to find out what answers they can and get that information relayed to their care team to make sure they can make the best decision for them as well.
Yeah, it's a great point. On the professional side, as an advocate, what do you think of the importance of collaboration? Because you, like, as an example, you mentioned you have a code person, but maybe there's a medical guidance, advocate who has a bigger specialty, or collaborating with someone like NAMAPA. Is that part of your practice?
It is. I absolutely, if I get a call from a client, I'll be the Johnny on the spot to let them know, hey, if this is something I don't think I can handle, let me see if I can find somebody that can. And I've tried to make a pretty good network, going to conferences, podcasts like this, just being able to reach other people, to make connections as best I can with other advocates, to find those who do specialize in certain areas and certain things. And maybe it's a difference in locality. If a patient is in a different area that may have different part of the country that's got somebody that's there close by, may be able to help them better than I could remotely, and maybe a particular disease. And I know this other advocate has worked with clients in that area before. They may have more expertise on it. I've got other advocates that I've called before, just, hey, I've got this issue, what do you think about it? Being able to bounce ideas off of people to come up with different solutions to the individual problems to try to provide the best service for our clients, whether that's me providing it or referring them to somebody else. my end goal is to make sure they get the best out of their healthcare as possible.
Yeah, and I think that's a running theme you see with at least the advocates that we've had on the podcast is people want to help, and so that's why they've gotten into this field. And the question is, if I'm not the best person, how do we get you to the best person? When it comes to educating yourself and staying connected, is there a lot of work to kind of keep on top of things? Because the landscape is always changing in the healthcare field.
It is. It's tough to stay on top of it, and there, like you said, there's always changes. So I don't claim to be on top of everything by no means. I do my best to stay on top of it, whether it's listening to podcasts from across the country, different topics on there, going to conferences, seminars, continuing education. As a board certified patient advocate, I'm required to have 30 hours of continuing education to renew my certification on there. So going through those continuing education programs, anything I can to learn more about a topic. If I get a client on and it's a disease that I'm not really familiar with, and I'll let them know right up front, hey, I haven't worked with this, or it's something unique on there, I'll do my homework with that to research to try to find out what specifics are tailored to that particular disease or condition that they've got, if there's anything that may benefit them. Oftentimes I have clients that call and they're looking for another opinion. They just don't know where to go. And if if you're needing you've cut your finger and you need stitches on it, you can pretty well go to any hospital, any ER, somebody can stitch up your finger. But if you've got a very specialized rare disease, maybe the local hospital is not the place to go. Maybe even the largest university hospital close to you is not the best place to go for. There may be a group of physicians 3 states over at a university hospital that is doing trials on this. They've studied it, and this is their life's work, is this one particular disease. And I try to research and find where that's at to give my clients the option of, hey, here's some other places if you're looking for a second opinion of where might be another option for you that you may be a good fit for.
And do you find that when you go to these seminars or conferences, I know there's another one coming up in September in New Orleans, and do you find that just kind of going and attending this stuff kind of exposes you to things like that you might not even see otherwise, where you...
Absolutely. And I tell you, the single biggest thing I have got out of these conferences going to is meeting other advocates, finding out what they're doing, how they're helping people. We're always coming up with different solutions to things, and if you don't communicate that, you can't spread that and help other people. So that really helps to broaden my network of other advocates, other people in the industry. At the conference you mentioned in New Orleans, there will be folks from different pharmaceutical companies, different insurance. I mean, there's just all different platforms of people that will be there, different hospitals. So there's tons of connections to be made to help navigate through this process. And you never know when one of those may come up, and you may meet them this year, and 3 years down the road may be hey, I've got somebody that's in your area that I need your expertise for, or I need to refer you to them, or they're coming to your hospital. Can I call on you to find out who we need to help them out, just to whatever we can to help.
Your company, Sunback Moon, is there a fun story or a reason behind the name Sunback Moon? It's not what you immediately think of when you think of that.
I had a colleague of mine said that name will never fly because people don't know what it is. So I put the tagline out behind it of Sunback Moon, Private Patient Advocacy and Healthcare Solutions.
Sure.
But the Sunback Moon comes from when my daughter was going through treatment. And I told you she was 7 months old when this tumor was found. So she was really young, and took, 2.5 years going through this treatment. She had all sorts of chemotherapy. We moved out of state for 6 months for treatment. So we did a lot. But when she got to where she could communicate and start talking, she wouldn't tell you that she loved you from the sun to the moon and back. She would tell you, love you, Sunback Moon. And that phrase just kind of stuck in our household, and it's still used on a day-to-day basis in the Byars household. And that phrase just kind of stuck with me, and I wanted to put that out there as a reminder of kind of the reason and why and how I got into this.
I think that makes it a real poignant and emotional and impactful name. I think, and for me on a personal level, my mom says it to my kids, I love you to the moon and back. So it totally resonates with me. And my
Sure.
kids say moon and back, and they don't say the whole phrase. It's very similar,
Sure.
so I totally get
Yeah.
it. And now I see it. I mean, if I would probably end up doing the same thing in your shoes, because it's always good to kind of remember why you're doing something.
Yeah. Sunback just moon just kind of stuck, and it reminds me every day when I see, our logo or business card or even my email address. It's a reminder of what I'm doing and why I'm there.
That's fantastic. How do you keep a balance? I mean, you talked about, and you were very boldly talking about how you are available after hours and you have your own family. How do you find a balance for yourself so that you don't get burnt out and you don't get worn out? Because it's a hard field. It's a field filled with really tough decisions and emotional states and stuff like that. How do you keep that balance for yourself?
Part of this of doing this after hours and outside of your routine business hours, I think stems from my background being in EMS. Responding with my local fire department, as a volunteer, it's not like I have a shift assigned that I go and I work this shift and I go back home.
Right.
We're all the volunteer fire departments across the country. Most of them, folks are in their house, they're at their work, they're in their yard or whatever. They get a call, they drop what they're doing, they go to that call. I've done that for 30 plus years, so it's kind of ingrained in me that you never know if at supper that there's going to be a call that you have to jump up and leave to go to. So I'm okay with having to drop things to take care of somebody.
It's become part of your life.
To help with a problem. It's become part of who I am, but I also like to travel, take vacations when I can to try to get away from it. I do occasionally will block off some time on my calendar that's just, I've got to have a cool down period. And I realized that back from, even being in the fire department, there's times that will go by that it's just, I've had too much, I'm tired, I'm turning the radio off, I've got to unwind and relax and not worry about going on a call. We've got others to catch that, and sometimes that's the way it is. Occasionally I'll get a call. Last year I had a call that come in right before we were leaving to go on a trip with my daughter for a follow-up with her care. And I told the lady, I said, look, I would love to help you. We are flying out tomorrow morning, going to Philadelphia. I'm going to be kind of unavailable the next few days. Let me pair you up with somebody else that's able to help you immediately as opposed to me. And so I use these connections I have to not get overloaded as I get to that point. I've got others that I can kind of push that work off to and ask them to, hey, can you pick up on this? And they do the same. So, I get referrals from other advocates and I'm able to refer to them.
And I think that kind of just is yet another reason why having that support and that network of people you can rely on is so important.
And I will say, I'm in Alabama, so there's only, I think, 8 board-certified patient advocates in the entire state of Alabama. Only 2 of us are practicing independently. So it's not like there's a plethora of advocates out there. I think there's around 1,200 or so board-certified patient advocates in the entire United States. So there needs to be more. And I've mentored others that are looking into going into this career field to try to help them make a decision. Is this something they want to do? Met with somebody, had lunch with a lady just 3 weeks or so ago, and she is looking into taking the exam this fall and going into that. And I told her, I said, absolutely anything I can do. And she's just down the road from me. Like I said, we actually were able to meet and have lunch and discuss things. And I welcome that with open arms more. I don't look at it as competition. We're all in this together to improve the healthcare system, to improve everybody's experience with the healthcare system, and try to improve everybody's outcome.
Fantastic. I think that, and that's the spirit that I think a lot of advocates have. And if anybody's listening who's been thinking of becoming an advocate, you should know that warm embrace of needing more advocates in the field is pretty universal. People see the need and need even just the referrals when you're going on vacation. You don't want a skinny little Rolodex. You want to be able to know someone's there to help.
Yeah. And I see this kind of bouncing off of that, of the idea of an advocate. I see this a lot of times with healthcare providers. I go in with a client and they look and ask who I am, and I'll introduce myself. And sometimes they're not aware of what an advocate is, or their experience with an advocate is the inpatient hospital advocate that they've experienced that's employed by the hospital. And I'm up front with them very, very quick to let them know, look, I'm here to help the healthcare team just as much as I am my client.
Yeah.
Because if they don't get the information as a provider out of my client of exactly what symptoms are going on, what's happening at home, what experiences they're having that they're concerned with, if they don't get that information, they can't help them. And that, that goes to the communication piece of this. It's not just a one-way street. It's both sides. So I'm there working for my client, the patient, but it improves the care from both sides. It improves, the physician and the nurse practitioner, improves their ability to communicate with my client on there to make sure they get the full picture of what's going on and not just a little snapshot. So that often puts them at ease that I'm there to help both sides. It's not just the client, it helps both sides of things.
Jeff, thank you so much for all your time and wisdom and sharing your story. If people want to work with you, is the easiest way to go to sunbackmoon.com?
That's it.
Sunbackmoon.com. Jeff, I really thank you for all the hard work and trying to make the healthcare landscape a little more easy to navigate for people in this country. I really do. From the bottom of my heart, I mean, I'm so grateful that there are advocates out there like you.
I'm just glad to be in the business and being able to help people out. That's the rewarding part of it for me, is being able to help people.
All right. Thanks again. Have a good day.
Thank you.